We are live, Chair.
Thank you, Prananda. Good afternoon, Croeso. Welcome everybody to Power's Health and Social Care Scrutiny Committee. Thank you to officers and portfolio holders for attending today as well. We've got a couple of main items on the agenda, but before we get to those, have we got any apologies? Please carry on.
Yes, Chair. Apologies for absence have been received from Committee Member County Councillor Carol Robinson and from Cabinet Members County Councillors Jake Berryman, Matthew Dorrance and James Gibson-Watt.
Thank you. Anyone got declaration of interest for the day opportunities paper? If anybody knows, has close family that's in receipt of services or any close family connections to people who work in that service, I think we need to declare those. Can't see any hands up. Carl.
Yeah, thank you, Chair. My wife works in the care industry, so I just wanted, I think we got that down as a ongoing declaration. So
if we can have that as an ongoing one. If there's anything that touches on your wife's role specifically, then we probably would need to highlight that
okay.
separately.
I also have an auntie who's a social worker within Powys County Council as well.
Okay, thank you. Can we make a note of that? Disclosure of party whips. No. Minutes. So we've got the minutes from, let me just open it up. The 24th of September. And we had a good full committee at that one. So myself and Gareth have read through the minutes. Can I have, if anyone's happy? Oh, Chloe, you've got your hand up.
Thank you. Yeah, I was late. I had a prior meeting, so I joined halfway through, but I'm not listed on the attendees. I don't know whether I'm allowed coming late, but yeah, just wanted to let.
Oh, yes. Yeah. Are we able to amend that, Carrie Ann? As well as if we do, can we still pass it?
Yep, that's fine. I can make that amendment. And then it's just that Councillor Chloe, as she wasn't present for the whole meeting, can't propose or second.
That's fine. Thank you. Can I have a proposer, please?
Happy to propose, yeah.
And a seconder? Can't see any. Oh my.
Councillor Little, Chair.
Councillor Little, thank you. Okie doke. Right, so those are passed, and then
sorry, Chair. Could I just have a show of hands, sorry, from the committee for?
Oh, yeah.
Okay, thank you.
Thank you. Okay, and then we've got the impact of delivered savings 24-25. We're to receive a report from each of adults and children's. The way that they are in the pack is that adults are first. Sorry, Sharon and Pete. But that's throwing you guys into the deep end first. So who Nina, are you introducing this, or who's leading on this, please?
Thank you, Chair. Happy to hand over to Sharon, but unless Councillor Pete would like to say a few words in introduction.
No, I'd just like to draw people's attention to the fact this is the first time that we've bought a report like this, as well as actually looking at the content of the report. I'd welcome additional comments from members of the committee about what more they would like to bring in future reports, because whilst this is focusing on the budget savings, we will be looking to bring back other reports throughout the year on the impact of proposals that have come forward. So I'd like to use this as an opportunity to get things right. One thing I would point out, that I'm sure everyone will realise this, but no and yes or positive impact, it's not positive and negative, it's positive and no in Appendix A. I'll just pass you now back to Sharon Fruin, who's going to take you through this paper for us.
Thank you.
Thank you, Councillor Pete, and thank you, Chair. Pranam Dar, Sharon Fruin, Head of Adult Services. You'll have all seen the report, and the savings and efficiencies won't have come as a surprise to anybody, as we'd gone through them all throughout the year last year. But this is particularly coming back to just to share with you the impact and to highlight some of the non-delivered and how we mitigated that throughout the year. So you'll see that in Appendix A, there's a list of the service savings delivered during 24-25. They totaled 1.6 million, and there were a further 0.5 million undelivered carried forward. There were individual impact assessments prepared, and there was also some of them covered through the overarching general impact assessment that was completed corporately. You'll see. Sorry, did somebody ask? Sorry, I thought I heard somebody ask a question. No, sorry, must be just my end. Sorry. Okay. You'll see that the positive impact of the 5 savings that are in 3.4 are explained. So we had the void management, and just to give some detail around that, we have several supported living schemes, and this was about making sure that we were able to manage the occupancy of the supported living schemes to ensure that we had as little vacancies as possible, therefore making most use of that resource. We did that through establishing regular overview meetings of the current status of the supported living schemes, but also meetings to discuss those individuals coming through with accommodation needs that we could plan for. And as I'm sure you'll take on board, actually living together is a complex situation, and actually putting people and asking people to share their homes with each other is complex. So there's a great deal of thought that goes into this, and it can be complicated and time consuming, where we have to go through a quite detailed matching process to ensure that we don't impact negatively on tenants by actually introducing a new tenant to schemes. So what we did throughout the year was we refined our process. We became more proactive in the way that we matched people to schemes. We had greater oversight of the vacancies, and therefore we were able to reduce the voids. So actually the resource didn't change. We still had the same amount of tenancies. We just used it better. And so I would argue that actually that was a more positive outcome for people. So it was a positive impact in doing so, not just for the outcomes for the person, but actually resource-wise. Redesigning our locality workforce. This was something that we had piloted previously, and it involved changes in our management structure for our community teams, and with a focus on making sure the teams were we increased the management structure across 4 areas, and we gave greater management oversight, having that locality focus. Staff have fed back to us that they had greater access to management. Decision making was clearer and more efficient, and the knowledge of the locality was enhanced by having those specific managers across in more refined geographical boundaries. So there was a positive impact there, no negative impact. The strengths-based assessment process around domiciliary care. This was an area of work that we've been working on for some time, many years, and we continue to do so. But we're refining the way that we do it. We're trying to make sure that actually the allocation of care packages is right-sized from the beginning, and in doing that, we make sure that people have the right level of support, that the support can flex by conducting regular reviews, and we make sure that there's no over provision, no dependencies created, and that we're actually supporting people's independence as much as possible. Some of the work that we've done is look at our strengths-based approach. We've had more training for staff to make sure that we're more focused on independence, and some of the work that we continue to do through our transformation work streams takes that to another level around our development of independence plans for individuals. So in doing this, we moved some resources around to make sure that we had dedicated officer roles looking at reviews, supported with some of our re-ablement and now our enablement workers to do some of that work in a more timely fashion. And in doing so, we were able to reduce packages where appropriate to do so, and use things like technology and equipment instead of physical resources, as in staff, to support people instead. So in doing so, we created a situation where we were freeing up domiciliary resource so we could provide more, and individuals still had their needs met. So there was no reduction in people having their needs met, just changes in the way that we did it and making sure that where we were able to reduce support, we could. So no negative impact. It was actually a positive impact with people having greater choice and control. And then the final one is around our increase in our number of shared lives carers placements, and reducing the use of residential care. This is something that we in the year 24-25 we didn't progress as much as we'd hoped. It's a quite a complex situation, getting the right resources and recruiting shared lives carers. So we did some precursory work to the pathway that is actually coming to fruition now through our transformation work around identifying those people who could actually step down into less supportive accommodation, people who might be available, suitable for shared lives, but also understanding what we need to do to increase the number of shared lives carers. And in doing so, we've now got a plan to create a recruitment role in shared lives. So this wasn't altogether done in earnest that year. It was some preparatory work, and so we didn't see an increase in shared lives, but we did see an increase in supported living and step down from residential. And in doing so, people gained independence. They also gain an economic benefit from living in supported living rather than residential, because they actually then have access to all of the benefits that they're allocated. So there was no negative impact and actually a positive impact. The final one is the funding body review. As you know, this is also a piece of work that happens every year, and this is about us working together with the health board to ensure that people are getting the support that they need, and it's funded via the most appropriate funding stream. So if somebody has needs that would be deemed eligible for continuing healthcare, that we are able to evidence that and then actually put a case forward through the relevant assessments to access that type of funding. Where we think there is a mixture of needs, we've built relationships with the health board so that we've actually got a very fruitful and transparent process around agreeing the funding allocation for the person based on their needs and who is the right organisation to fund that intervention. So where there's joint funding, we do more of that than we have previously. So that, again, the care for the individual, the support for the individual isn't affected. That does not change. It is only who is funding that care and support. Is that okay on the delivered savings, Chair? Yeah. Okay, so the next section in 3.5 goes on to discuss and explain the undelivered savings. So the first one is the day opportunities provision. This programme of work was extended to include learning disability provision and became a quite complex and intensive piece of work with lots of engagement work taking place. So that is the reason for the delay in the delivery of that saving. The work has continued throughout this year, and we plan to deliver that saving this year, with the work being completed by the end of March 2026. The extra care scheme that is itemised in the next bullet point is was delayed only by a few months, but it was delayed due to issues around registering the building. So that was the delay in that, but delivered the following year. And transforming older people's accommodation, we had some conversations with our colleagues in the health board around some services that we jointly operate, and redesigning those. And we had intended to do a specific piece of work around reviewing some of the services. We actually changed our minds on that, and that was because of a change in demand, and after doing some further research, understanding that we wanted to use that resource differently rather than removing it. And in doing so, we've actually improved some of the hospital discharge pathways. With the 3 elements there that are undelivered for that financial year, we were well aware of the undelivery, and we were reporting the position through our outturn reports, and we mitigated the undelivery through over delivery in other areas, in particular the right sizing around domiciliary care. Appendix A goes on to give you the detail for each of the savings delivered, and you'll see there the over delivery of the strength-based assessments and the links to the impact assessments.
Yeah. Okay.
Happy to take any questions, Chair.
Yeah, thank you. I think it was interesting too and helpful that Pete is open to us like thinking about how this report will go and work going forward. I think my question mark is really when the timing of it is best placed during the financial year, and whether now is the right time. Would it be more beneficial if this kind of report came earlier in the year, or would it maybe not be ready earlier in the year? So that's sort of something I just want to float as what I'm thinking about. I know we do have some questions, so I'll go on to members now. Gareth, did you have a question about achievability of undelivered savings?
Yeah, I've got an initial question though before that.
Okay, go for it.
Under 3.5, under the day opportunity provision reviews, the last sentence says that it had no impact on client users as the existing service remains in place. Does that mean that the existing service that was in place in 24 still remains in place now in October 25, or has there been changes made to day opportunities in the interim since April? And then the second question, as the chair said, do we have the assurance that the 450,000 unachieved savings in 24-25 will be made in 25-26?
Okay, thank you. Nina, I can see you just put your hand up. Did you want to come in on that question, or is it on another point?
No, it was actually in response to that, Chair, if I can.
Yes, thank you.
It should say remained in place. So the existing service remained in place, because this report is all about last financial year. So
yeah,
it's
that's
looking
the
at
point. So it's a typo rather than.
It is. It's a typo, and for myself, I think, as well. So apologies for that.
So it remained in place.
Remained in place.
Yeah. Okay, thank you.
And on achievability, Sharon, are you able to take that?
Yeah, certainly the day opportunities and the extra care, we've done some work that stays the same, that's achievable. The transforming older people's accommodation, we need to do some further work on that, but if it's not around the transforming older people's accommodation, then we will be looking to mitigate it again this year.
Okay. Right,
okay.
So that one may not be achievable, but you're already looking to overachieve on other things.
Yeah.
Okay,
yes.
Thank you.
Okay, and then that will, when we come to look at the budget in January, that will factor into what you consider as potential cost efficiencies for next year then?
Yes, Chair. And if we on further analysis, if we have ruled out that efficiency, then we'll be coming back to say why we can't do it and what we're doing instead.
Okay, thank you. Councillor Chloe.
Thank you. So I've got 2 points that are kind of related and maybe just clarification really more than anything else. But I know what you say about no adverse impact of some of these savings. And I just wondered if you could give me a bit more information about how that's been determined. Is this from user feedback, complaints data, or staff monitoring? How do we come up with the fact that it's got no adverse impact? And similarly, you mentioned about the strengths-based assessment and great days overachieving. That's really good and it has a positive impact. But I just wanted to check in there as well about how that positive impact has been determined. Again, is that user feedback? Just to make sure that increased independence hasn't resulted in any unmet needs. How do we know there aren't any that we're kind of missing?
Thank you, Chloe. Can I just build on Chloe's first question as well in terms of the user impact? Is that a quantitative assessment in that users are still in a retained service, or is there any qualitative assessment in terms of maybe how the users are feeling, knowing that changes are anticipated, or any impact on the fact that a lot of these service users are vulnerable individuals, and that might cause anxieties not just for them but also their network around them. Has that been factored in to your assessment on whether or not there's an impact, or would you maybe reconsider the sort of indirect impact? I don't know if indirect is the right word, but I think you know what I mean. So those are the two questions from Chloe, one of which I've built on.
I think they're really pertinent points and things, and actually it is an area we've been discussing actually this morning in our Live Well forum about how we get better about understanding the impact of our service delivery. So for many of the delivered savings in the year that this report relates to, it was actually more of an operational change other than the strengths-based, which is a reduction. And where there is an operational, it is about anecdotal feedback. Services have remained in place and remained at the same level. With the strengths-based, some of it is anecdotal, and so we look at how many people are representing. Have we had to then increase packages of care after the subsequent reduction of care? So we do monitor that and track that. The reviews would have been conducted. The decision to decrease packages would have been done through a review. That review would then have been recompleted afterwards. Sorry, stumbling over my words. The next review would have then asked the individuals, how are things going? Are things still going well? Is there any changes we need to make? So there will be a follow-up through the next review. And we also then track through some of our strengths-based case studies that we do, and we bring that back to, we've just had a realisation day where we've reviewed some of the work that we've been doing around strengths-based, and some people have shared their stories with us through so we can inform practitioners of the benefits of the strengths-based. So not every single person would have had that opportunity to directly tell us their story, but we do capture some case studies to review progress around strengths-based.
And the second question?
Sorry, Chair, can you remind me what that was?
Yeah, Chloe, can you remind us your second question?
I think that's they're both kind of linked around feedback. So I think we've got both of them in terms of that review, that going back and speaking to people and getting the anecdotal reports, and then also measuring the amount of changes in care or lack of, as it might be.
Okay, thank you. Councillor Little.
Thank you, Chair. You'll not be surprised that I've come prepared with my usual mountain of questions. I'm happy to drop them in the chat now so that Nina and other officers can have them in front of them. And I'm, of course, happy to email them after the meeting for them to be answered. But if I could be given a few minutes to just state them out loud for public discussion.
I definitely want them in the chat and over email because they're always really helpful. But if the questions that you can go through today, can they be so I know, because obviously the things in the paper can lead on to us questioning all kinds of things to do with those different parts of the services. So if we can keep them based on the financial impact and on anything that's referenced directly in the paper, that would be great. But it might be that that gives us food for thought for things further down the line, if you know what I mean. Is that
Yeah, I have already posted them into
Okay.
the chat. There are but I do have some of them in there which I thought were quite relevant for the financial side and the statistics and the numbers.
Oh yes, please go for those.
Looking at the these may have been covered in the presentation, and I do apologize in advance. These were written up before the meeting. Looking at the funding body review, Appendix A, where we have it listed, it appears as a backdated one-off pressure reversal with a -1 million entry that needs reinstating the following year, and a separate funding body review marked as a positive 1 million delivered. If residents experience a change in who pays for care, that can create hidden risk for families, particularly disabled residents relying on stable packages. Can we see the gross, the reversal, and the net effect from 2004 to 2005 and confirm whether any element is a one-off rather than a recurrent, and tell us exactly what resets in 2005 and 2006? On the line, that reports a 306.02% achievement for the strength-based assessment to domiciliary care supporting a direct payment model. What was the original target, and how was the greater than 300% achieved? If the saving came mainly from shifting packages into direct payments rather than genuine independence gains, have we merely moved the cost on and risk onto families, including unpaid carers who are already stretched? And I'd be interested to see how much came from measurable independence gains, how much shift from direct payments, and how much from ceased or reduced packages. I'd also like to see how this impact outcomes for disabled adults over the same period, covering unneeded meds, referrals, hospital readmissions, and safeguarding alerts.
I've got a question that builds on that actually as well, little. On that 300%, is that down to what didn't come out through our demographic forecasts? Did we not demographically predict this? And in that case, do we need to revisit how we demographically predict things for the next financial year? Because obviously you've overachieved what you hoped to be able to right size package, if that is that the right word? So yeah, I'll just add to that. Sorry, go on, Little.
Do you want me to run through all the questions?
I think actually we've probably got enough to get us started. I'm mindful of time in that we need to get on to children's probably within the next 15 minutes. So Sharon, Nina, are you able to pick up on those?
Chair,
Yes.
I'm happy to come in on the funding body review and then Sharon in the second. But the funding body review is shown once as they're one-off savings. They're not recurrent, Councillor Little.
Right.
So that's why you get the plus and the negative. So just to answer that for you. And if you're okay, Chair, for Sharon to then answer the rest of the questions. Thank you.
Yes, thanks. The nod, the reference to direct payments, most of the direct payments right sizing where there was packages that people had surplus in their accounts that they had regularly not utilised all of the allowance for them. So those were just around actually right sizing what they weren't using. So there wasn't a removal, there wasn't a shift. This was surplus money in people's accounts that they just weren't using. And we were just reviewing them and then resetting their balance to a point which is accurately reflects the support that they needed. So it wasn't actually a shift to more carer related support. It was just actually accurately reflecting the support that somebody was needing and wanting. That was the direct payments.
Okay.
So the reason why we've overachieved is that we actually dedicated specific resource to to those specific roles of reviewing people's packages, rather than we added on to the direct payment works because we knew that we had to mitigate in other areas as well. And we had developed a methodology that was providing good results for the individuals and was working for the teams as in efficient ways of actually conducting those reviews.
Okay, thank you. Councillor Little, are you able to put any other questions forward in writing? I'm just a bit mindful of time.
Yeah, I can do that. I can send an email now.
Thank you. Councillor Chris.
Thank you, Chair. And Councillor Little asked some of the questions that I was going to pose, particularly around the funding body review payment and also the direct payments. Just as an observation, there are two PDF documents that seem to be linked to this paper. I can't open those on there. I wanted to drill down in some of the further information. So just to let you know, that wasn't accessible from the papers that I've got. Just a couple of small things on there, but I just think would enhance things. In relation to funding body review, I think it would be helpful to have some clarity within the paper of what that meant. It didn't seem to be there, and it would just be helpful, particularly if these are in the public arena as well, because not everyone understands where that funding body is, so that would be helpful in my view. I just wanted to make sure it was 306.02%, was that correct? And then in that first column, you've got no yes positive impact. There's no yes on there unless the P is given the positive impact to mean there was a positive impact. But again, there doesn't seem to be that explained of where that positive impact was. So those would be just some of the comments on there. But I think this paper is really helpful and enables us to do a bit more scrutinisation to it. So that's help. And I'll stop there, Chair.
Thank you. Any comments on Chris's observations?
Chair, happy to come in, but that's really helpful feedback, as Councillor Peat said at the start, this is the first time that we're working through that. So, taking back comments about more detail on what the cost efficiencies are, appreciating it's been, a while now since last year, etc. That would be appreciated, and more of an explanation on the impacts, etc. So, no, happy to take that back and feed that. Thank you.
Thank you. Councillor Gareth, are you able to wrap up?
Yeah, just very, very quickly. You question the timing of this report, and I note that this is the first time we've had it. In my mind, because the accounts are closed by the end of May, I would have thought we should have this during the latter end of the summer, so in a July meeting. But I have got a question in two below the one around strength base. There's a target there, increased number of shared lives care stroke placement is only 70% achieved. Why isn't the other 90,000 shown as carried forward to 25-26, or how did we meet that in 24-25? Just remind me.
Sharon?
Yes, thanks, Councillor Gareth. The mitigation was through the increased delivery on the strength-based assessment.
Okay, thank you.
So does that mean that they've received a different type of service than envisaged?
Sorry, Chair. I thought Councillor Gareth asked me how we delivered some of it and not all of it.
Yeah, and why it wasn't carried for the same. But I think your explanation is right. So in effect, part of the 306%
Yes.
is really 30% of the unachieved in that time.
Yes.
Yeah.
Okay, sorry, I understand in that what you're saying is that they didn't need those placements, they would have needed something else. So because you looked at it from a strength-based view, that the shared lives carers wasn't needed. Is that what you mean?
Some of the work that did deliver some of that was around reducing the support in the supported living. Yes.
So right size packaging.
Yes. Yes.
Okay. Yeah. Thank you for that clarification. Councillor Peets.
Yeah, I just wanted to move on to the what can we do better, and just want to pick up on Councillor Gareth's point about end of year closure times. I am slightly concerned, I'll defer to officers on this, about whether we would actually have enough time between the end of the financial year and June, July meetings to actually properly assess the medium-term impact of some of the changes. Because obviously some of these changes will have taken place on day one of the financial year, but some will move through the year and we might not have a full picture that we can share with you.
Okay.
So it's a question really for
Yeah, I
officers
think what we
themselves to
probably
think
do,
about.
Pete, is make a recommendation that we would like the timing to be considered, in that for our perspective, the earlier that it's ready, and you know, we obviously wouldn't want it watered down in any way because of the timing, but it just helps us prepare to scrutinise the budget more thoroughly. So rather than stipulate we want it by July, and I'll ask the other committees for the review at the end, but my inclination is a recommendation for the timing of it to be given consideration. So yeah, right, thank you. I think we'll move on to children's now, because I'm just mindful that we've got to get through another one of these and then we've got to get on to another main agenda item. So Sandra and Sharon, Powell, are you able to bring in the children's undelivered savings impact report, please?
Diolch yn fawr, Cadeirydd. Prynawn da pawb. Thank you very much, Chair, and good afternoon, everybody. With section 1 of the document that we have in front of us, it outlines the purposes of the report and to provide an overview of the savings delivered for children's services, and considers whether through the delivery of those savings that there has been excuse me, any impact on residents, communities or objectives as set out in our corporate and strategic equality plan. Section 2 outlines the background, the audit, Wales Financial Sustainability Review in November 2024. The Corporate and Strategic Equality Plan, with a vision of the future of Powys, stronger, fairer, greener. And Section 2.3 outlines how our ambition were really achieved, and sets out 3 objectives that are core aims and corporate and strategic equality plan. Section 2.4 confirms the service head's assurance of delivered savings and highlighting any adverse impacts arising as a result. And Appendix A provides a list of savings delivered. Section 3 explains the information provided in Appendix 4A, and Section 3 provides the key, as has been referred, with the adults document as well. 9 of the savings delivered resulted in having no impact on the service, and that's predicted with a letter P in front of it. Section 3.5 provides more information on the positive impact of 4 of the savings delivered, and just to reassure members here, Madam Chair, the full savings delivery relating to the 3 of these placements, 16 plus accommodation and special guardianship order, was not achieved in year. So the undelivered element has been rolled forward to 25-26. There was no impact on the service users, as they were all in appropriate care placements. I just wanted to reassure everybody of that. And the information in Section 3.6 regarding staff transformation depicts the importance of our staff and the need to retain our staff to deliver services. And Section 4 just identifies the resource implications. We were unable to deliver the savings due to the pressures of the service in the service, and the overspend position was reduced by the Welsh Government grant, which was received into the council, which created a balanced budget. And just to reassure members as well that every opportunity that we have to access any grants, that money is utilised to the max to try and mitigate any of the, make sure our balance is our budget is balanced. Thank you. I'll open it now for questions. And we've got, as you've said, Sharon and Nina here. And I'm not sure if Joe is with us as well. Thank you.
Thank you. Sharon, is there anything to add?
I think, yeah, thank you, Chair. And just to add, really, our overarching plan for children's services in terms of our integrated business plan is about keeping children absolutely the heart of what we do. And the strands of that work are around right help, right time, closer to home, and building a supportive and sustainable workforce. So I think it's just key to kind of just remind ourselves of what actually the objectives of the whole service are. And obviously the savings are aligned to some of those objectives about the bigger plan. So just want to point that out. And it's also kind of aligned to the Social Services and Wellbeing Act and the Future Generations Act. So there is legislation that sits around it, as well as the integrated business plan.
Okay, thank you. Right, committee members' questions. I think I just have one question, which is similar to the one that Chloe asked before, in terms of the where you've assessed the no impact, because the service users were retained in placements. But was there any impact in terms of individuals might have anticipated some change that then didn't happen, or would that not have been applicable?
I'll come in, Chair, if you like, on that. I mean, not necessarily any individual impact for individual children. It's very much, as you'll see, that the issue remains around the costs of placements, and placement costs have been rising over the last 2 years. And because there's a national shortage of placements, those placements costs have continued to rise because of the market around them. So it's not really had a specific impact on a individual child. That individual child remains within their family, where we can safely do so, either in a foster family, or if they need a residential placement, we place them in a residential placement. So changes don't necessarily happen for children based on this. This is more about need, demand. If a new child needs a placement, that's where we need to place that child.
Thank you. I thought that would be the answer. Thank you. Councillor Chloe.
Thank you, Chair. And yeah, got one of my questions sorted already. The other thing I wanted to ask, so you mentioned about the grant funding from Welsh Government, which is great, but obviously we can't rely on that every year. So is there a concern that maybe, what do we do if we don't get that £2 million next year? How are we working to make sure we're going to have a balanced budget in this area and we don't rely on these one-off grants too much? And then the second question, kind of related to what Councillor Amanda raised around the feedback and things. So the 16+ accommodation, particularly with this semi-independent living, I just wondered, are the young people being consulted about the suitability of these settings? Do we have any feedback from them about how they're finding these new placements and what they think of them?
Yeah, two really good questions, Councillor Macefield. So the first one, in terms of the budget, you're absolutely right. We can't build a sustainable service based on the reliance or over-reliance of Welsh Government grants, because like you say, we don't know if that's going to come or not. So what we do in terms of our integrated business plan is focusing on those 3 strands that I said. So in terms of right help, right time, closer to home, this is where this kind of features. So you will know that we had masses of investment into our fostering framework. So the idea is really to invest in foster carers, generate our own foster friendly organisations, so that we don't have to rely on those high cost residential placements, and wherever possible we return children home safely to their parents. We're also reviewing our residential homes that we have across Powys, so we had to put some of that on hold during this last financial year. This financial year we're looking at how we can kind of reopen some of our homes, maybe remodel that, just look at different ways that we can actually keep as many children as safely connected to Powys and their communities and families as is possible. So that's an overarching plan that continues. The aim of that is to reduce that need for high cost placements outside of Powys. In terms of feedback from children, we've got a number of different mechanisms around which feed into our participation strategy. Feedback is absolutely really important in terms of just reviewing where we're at, looking at things through the lens of children. So we have a number of different mechanisms where children feed back into the service. That's through this Junior Startwell board, which is a really proactive, well-engaged kind of way that I can get feedback quite easily from all age children. We have a participation officer that's absolutely specifically aligned to generating that feedback. So he holds regular sessions with children of all ages, and in particular with our children looked after, that's really key in terms of, like you said, are we making sure that those places that we're provided are in those right areas that they need? So there had been a lack of provision in Brecon. That is an area where children and young people wanted. So we were able in that financial year to be able to generate 4 new options for 16+ accommodation by working in collaboration with housing. So that was really positive based on that need. So that's just one example of that feedback loop.
That's great, thank you. Meg, I've got to come back on one point, if that's all right, Chair. Just for a bit of clarification, just to say, great to hear about plans for savings, and I'm sure it's very difficult to answer this, but so do you think you're going to be able to deliver enough savings to not require the grant next year? £2 million seems like a lot of savings to be able to make, but just in terms of when you're projecting forwards, what do you think the gap's going to be?
Very difficult question to answer at any given time, because obviously the needs and demands for children can change at any given moment. Obviously, we have a duty to safeguard and look after children when they become looked after. So that budget position can be very fluid at any point in the year. But what we aim to do is, with our fostering framework, is to generate as many foster families as is possible to keep those children, as I said, as safely connected to home. We've also started a new project this year called Step Up, Step Down. That's in line with some Welsh Government funding about a new approach within a fostering way of working, which I'm happy to come back to committee at a different point to share that information. But it's just looking at more innovative ways that we can do things differently rather than just remaining the same.
Cool, great, thank you.
Thank you. Councillor Gareth.
Yeah, mine's linked, I think, to a question that Councillor Chloe just asked around the roll forward unachieved savings. So how much of that 1.5 million do you think we're going to achieve in 25-26, and how much of that is not going to be achieved?
So we've just had our Q2 position for this financial year. So I can confidently tell you that we've achieved quite a lot of that saving in terms of the historical saving to date. Obviously, that report will come through to committee at kind of that time when it's relevant. So there is always a risk in terms of based on needs and any particular time when a child might be looked after, depending on the cost of that placement. But through the areas that I said, that is what we're trying to strengthen and to build. So there's a level of assurance, but there's also a level of risk attached to that.
Okay. So in terms of percentage-wise, how much do you think of that 1.5 million has already been achieved?
I think it's around about 70%.
So there's 500,000 that's at risk then, in effect, in round terms.
Yeah, and just a reminder, as one of our recommendations which came out of the budget from last year, which I think came from Councillor Ange, if I remember rightly, was that we would like the traffic light system reinstated for your anticipated deliverability of cost efficiencies. Well, that's a lot of big words in one sentence. So that will be helpful then to make that a visual for us when we come to it.
Councillor Chris. Take that forward, Chair. No,
thank you.
Thank you, Chair. And again, this report is really helpful because you can go into the detail. So let me just do that. You've got cost savings from using permanent social workers once qualified instead of agency, with 74,000 which saved. And then you've got further down that line, you've got a reduction in agency workers over 12 months through Grow Our Own. I'm just checking they're not of the same thing, because on that one then you got 200,000 of savings. So why have we got them separated out, is the question. On the And then you got a savings then with VAWDSW, reduction in hours. There's no explanation what that VAW is. What was the impact with that reduction? I know it made savings of around 11,000 that you've indicated there. And then you've got Edge of Care grant funding utilised differently. Again, within the report, I didn't see how that was utilised differently, and I didn't, or I may know what Edge of Care grant is, but do others? And therefore, an explanation of that would be helpful in my view. Thank you.
Okay, so in terms of the agency staff, historically, going back a couple of years ago, there was a set amount of money put into the budget which was allocated to agency expenditure specifically. So that one line where you see the 74,000 is equated to that pot of money that was around 500,000 at one point in terms of that. So each year that has remained until we kind of get that back down to zero. So the other line is additional agency on top of that. So you'll know that we've been successful in terms of our Grow Our Own project. So historically, we had around 57 agency workers going back a couple of years in the service. So that's what came out of that kind of 500k pot. With the other line, it's around the investment into Grow Our Own and that further reduction of agency workers. So it's not double counting, it's absolutely counting separately, but it's just been aligned in two different ways. Going forward, it probably is helpful to have that just as one line, and then that probably would make a lot more kind of realistic sense in terms of the budget lines. But the assurance is that those agency workers have reduced now to 10. Over the next year, they will hoping to get that down as close to zero as we possibly can do. In terms of your line about VAW DSW, so that's VAWDA SV, so that's against violence against women and domestic abuse. So what we did, there is a corporate responsibility around this area. So the service didn't reduce at all. It was just about a different part of the corporate service picking up that work that sits within that. So it was felt that we no longer needed to specifically deliver that ourselves. It was taken on as a corporate objective. So that's where the saving came from that, but there was no direct impact in terms of training, any kind of conferences or events that actually align to that issue around domestic and violence against women and domestic violence, etc. In terms of Edge of Care means those children that are on maybe the periphery of maybe becoming looked after. So that's where there might be some complications at home, where the family might be struggling in a different way, and they might need some extra support. So what we did, there's periodically Welsh Government will release money around intervention and prevention. So we just use the grant to deliver services in a slightly different way, and then we're able to free up the base budget to do something different. So it's just about no change in actually any direct service to children, more about just using those grants in a different way to be more financially efficient in terms of value for money.
Thank you for that explanation. I think that gives assurances around them, and well done for growing our own. I think it's the right way to do.
Yeah. Thank you. I can't see any other questions, and I don't have any other questions other than to go back to revisit the timing of these reports. And I don't know whether Sandra or Sharon, you have any comment on, from your perspective, when would it the earliest it be ready? And are you happy if we do consider a recommendation for this to look to whether it can come earlier in the year?
I can understand and appreciate them. Oh, sorry, no, I thought I was on mute then, sorry.
No, you're not.
No, I can understand and appreciate the urgency and the requiring of the facts and the figures, but as Sharon has alluded to, budget might be fine today, and then tomorrow something might happen and it'll throw everything. And that's the way.
Oh, we've lost you.
Certainly, Chair, from my perspective, I'm happy to take advice from the committee in terms of when you would prefer those reports to come through. I think there is maybe some consideration in terms of transformation of the service and then where we're at and how that aligns to our integrated business plan in terms of the
our budget works. So it's just a
Sorry,
picture really of where we're
Sandra,
at.
we lost you for
Hello?
probably about 30 seconds.
Yes, I know, sorry, it just went blank. I must have got thrown out or something. Yes, I'm still here thinking that you had frozen, but it was me, sorry.
No, we lost you, but Sharon was saying that that she would be open for us and for you guys to consider, you know, where it would work best in terms of slotting in and the information that can be generated for it. So I think it's probably something we will leave with you, but it will be our recommendation for it to be considered. Gareth, is something that you wanted to add?
Yeah. So sorry, I just need to disagree with what Councillor Sanders just said. You know, this is an update on the outturn figures for 24-25.
Yes.
Sharon's just told us that they've just had Q2 figures for 25-26. Therefore, there's no reason why this report cannot come, in my mind, 2 to 3 months earlier than it has.
Ah, right. Okay. Thank you.
That's my view, and I'd be happy to be corrected, but that's my view. Because it's
I don't want to make a definite direction on this, because I think that it might be different for each service. But I do think, you know, our recommendation is that we're nearly at November, we start looking at the budget in just a few weeks' time. So if certainly at least, you know, a month earlier if possible, but I'll leave the rest with you. Nina.
Yeah, thank you, Chair. Sorry, I was just going to probably say what you've just said, actually. Happy to take it away for discussion in terms of timing. I think we could bring a report earlier, as soon as possible, you know, after the end of year reports, etc. So we could certainly do that. And there is also something positive about looking at it just before we're going into the next budget round as well, actually. So there is that. But yeah, no, happy to take the timing away. And yes, we can bring it sooner if that's what's requested.
Brilliant. Thank you. Right, moving on to the next agenda item. Sorry, I'm just scrolling back up and down. We have got sorry, 1 second. Where's the recommendations one? Oh no, that's 8, sorry. We've got the Adult Social Care Diagnostic Working Group. I think we just have a question on this in that as a committee, we are incredibly keen, and there's a lot of us that would like to be on this group, but in the papers it says 3 members. So we have asked our scrutiny officers if they will kindly check what is the maximum allowed of people allowed, and then can we give those names in due course?
Chair,
is that
if it's all right, I'll come in on that one.
Yeah.
There is no minimum, no maximum. We do tend to work on 3. As we have in all previous scrutiny working groups. We can go up to 4. I've heard that there's possibly going to be 5, but at the end of the day, Chair, I will pass that back to you as to how many people you actually want on that that working group. Remember, it's a working group, not a committee.
Yes. Sorry for my mistake with that phraseology. We've got 6, so can we park it and can I come back? And there's one individual who I would like to speak to personally about it, because I don't want to put their name forward without having had that conversation. But when is the deadline for you having the confirmation?
As soon as possible. I'm not going to put a deadline on it.
Okay.
Just we obviously want to get the working group set up.
Just we feel that we all slightly bring different things to the table.
And that's the issue. It is a working group, otherwise the item will be coming back just to committee.
Yeah. Okay, right, leave it with me and we will confirm in due course, but it's positive that we are so keen.
It is. We also want just to clarify, when you do that, the actual purpose, so a terms of reference can be set up for that specific working group.
Yeah.
Okay.
Great.
Thank you very much, Chair.
Sorry, I'm struggling scrolling back and forward between all the papers. Work programme, can we park that for now? We just need to have a rejig of some of the wording and make sure that December's meeting isn't too full, but there's also a possibility of one paper coming forward as an extra meeting in November. So can I have a conversation with Nina and scrutiny officers offline about that? Is that okay? And then agenda item number 8, we have reviewed the scrutiny, the response to our previous recommendations, and I don't believe we have any further questions. We have all commented that it's really positive that you have accepted those previous recommendations, and there's one which is partially accepted, which we absolutely accept your wording on that, and the reasoning why that's partially accepted, and that is to do with the recommendation regarding having executive summaries at the beginning of reports. And yes, we accept that there may be some times where that doesn't quite work depending on the nature of the report. So yeah, we're happy to accept those. And that brings us on to the potential exempt item. I just wondered, would committee members like I'm just thinking it's 10 past 3 now. We've got 50 minutes of the I nearly said lesson then, sorry, of the committee meeting left. Would members require a couple of minutes comfort break, or are you happy to press on? Stick your hand up if you would like a break or happy to go on. Okay, I think we're happy to go forward. We have had some, Councillor Ange. I know hand's gone. We have had some initial discussion in the pre-meeting before about whether we can be given some explanation on the nature of why this is requested to be in confidential session. So it would be really helpful if you could set out the reasoning for that. We've also had some preliminary discussions on that. We, as a committee, feel that the process timeframes and next steps need to be as transparent as possible for members of the public. That's something that we have just raised today. So if that kind of explanation isn't able to be given sort of off the cuff, can that follow by way of a written update, but also we may or may not consider making a recommendation when we're in our private session as to whether that we may suggest that there's a public update needed on the process in any event, but we'll get to that in due course. And before we go on to vote, could we and I'm happy for this from either the cabinet member or Nina or head of service Sharon, can you please give an explanation as to why you feel this needs to be in private session, please?
Thank you, Chair. The information that we're sharing with you today, we believe should be in a private session for a number of reasons. Firstly, it deals with a very small number of providers and relatively small number of users, so there is a distinct risk of identification either directly or during conversation via Jigsaw, which would breach the confidentiality of those users. The second reason is that the information we're sharing with you in part relates to a process of change within the staffing structures of the authority and may contain information, again, directly or during conversation, that members of staff who may be directly impacted have not received as part of the employment process. So we're very concerned that in taking this in public, we may actually prejudice the rights of those individuals under employment law. Moving forward, I'm not happy with us having to go into private session, and working with yourself, Chair, and officers, we'll be looking to, wherever possible, bring forward split papers in the future where we're separating out policy from implementation, because obviously there are times when scrutiny have a really significant role in implementation, but that may be prejudicial in a number of areas, financial, personal or confidential. So that's why we're looking to take this paper into private session today.
Thank you. Anything to add, Nina or Sharon? No. Members, have you got any questions on the reasoning, or are you happy to go straight to a vote on whether we go into private session?
Chair, I think it's important to thank Councillor Peat for his input around
Yes.
that, and
Yeah.
I think that would be really welcome, but I'm happy to propose that we go into private session.
Yes, yeah, no, thank you, Pete, for that, being willing to take on, you know, going forward in terms of the split papers as well. That is appreciated. Councillor Josie?
Just to repeat what Councillor Gareth had mentioned, that it's great to hear that response from Councillor Peat. Thank you. And I second moving into confidentiality meeting from now.
Thank you. Can I have a show of hands if you are happy to go into confidential session?
Okay, Chair, I'll move us across now.
Yeah, thank you. That's everyone.